Welcome to Lessons in Leadership. I'm Steve Adubato with my colleague Mary Gamba. Mary, we have, for the first time, one of the top healthcare leaders, part of our Leaders in Healthcare series. This is Dr. Dustin Riccio, who's president and CEO of St. Joseph's Health. Doctor, how you doing?
I'm doing well, Steve. Thanks for having me on.
It is great having you. Listen, we're going to talk healthcare in a minute. And Mary, you don't have to be part of this, but I know you care. Dustin, is it not a fact that your family is from Centola, a small town in Italy, the Centola coast? Is that true?
That is absolutely true, Steve. Thanks for bringing that up. Yeah, very proud of it. Very proud of it.
Mary's sitting there going, I can't believe he did that. We're supposed to be talking about healthcare leadership. Mary, I will do that, but that's a separate segment just on Dr. Riccio's trip to Italy with his family. Okay, Mary?
Perfect. I'll definitely get it in the queue.
Got it.
Thanks, Mary.
Dustin, 25 years together, Mary and I work at it. Her patience is running thin with me. So let me do that. Dustin, let me ask you this. We've done so much work at St. Joseph's over the years with Pam Garrison, your team, and others on communication for healthcare leaders. Question, why is it so important from your perspective for not just clinical leaders, physicians, nurses, others, but people in healthcare to communicate more effectively, to be understood by people who weren't trained in healthcare with all the jargon?
Yeah. Well, I mean, first of all, we're talking about some of the most human things, right? We're seeing people in their toughest moments, and how we communicate with people in those moments is really what people think about us as not just physicians, clinicians, but also as leaders. And it's been something that, going back to my grandparents and my mom and dad actually too, it's what they always taught me to do is to sit there and then listen, digest, and then respond. And what we as physicians often try to do is try to respond a little too quickly, and we need to just sit back, pause for a quick second, recognize people in their toughest moments, and respond appropriately.
Quick follow-up before Mary jumps in. A lot of my work as a leadership and communication coach has been with physicians. And we do a physician leadership academy, as you well know.
Yes.
And some of your physicians are involved in. Here's what I'm curious about. Physician leadership versus executive leadership, any different? And if so, what is the significant difference, Doctor?
Yeah, I can go on for a long time about this one, Steve. I think there is difference, only in what we were just talking about, right? I first and foremost, what I would say is this: is as physicians, unfortunately, going back to that classic model, we were never trained in leadership. However, everyone always has looked at physicians as leaders, and so here you have this group of highly trained individuals with a certain skill set, and they are put out in front of an entire organization and termed as leaders, but were never really given the skill set to actually prove themselves as leaders. Now, what we are doing today, and some of the work that you are doing as well, Steve, is really changing that, right? We see a lot of physicians actually spending time in leadership academies, going to get their MBAs, their MHMs, their MMMs, and as a function of the work they're doing there, they are actually becoming leaders. And they're getting up to speed, back to your question, as some of the executives that are out there, because the executives that are coming through these tracks and into healthcare as well, they've been given that training. And what my hope truly is that the physicians who are now tacking on that leadership level are actually have the human component and the leadership component to go along with it. And that is what, in my opinion, makes a great healthcare leader. And that is not to say that executives don't have that human component, but there are certain trainings and skill sets that physicians have gone through and talking to people in those toughest moments that we talked about that really make them special in many different regards.
Very special. Mary, please.
Sure. And Doctor, you talked about physician leadership, you talked about executive leadership. Let's talk about leadership as a whole. Steve and I often have the discussion here on Lessons in Leadership of, is everyone a leader? So whether when you walk into a hospital and you see the receptionist, whether it's nurse leadership, if it's somebody in the housekeeping area, in security, talk a little bit about the need for creating a culture, especially in a healthcare system at all of those different touch points with the patients, that everyone truly must be a leader. What does that mean to you?
What it means to me, Mary, is I believe everybody to be patient facing in our organization. And when you are patient facing, especially if it says St. Joe's or a healthcare organization on your check that you get every couple of weeks, then it means that you are a leader for that organization, because driving that patient experience is what we need to see, right? And whether that is one of our frontline staff or the CEO or one of the SVPs in the executive suite, everyone has to be carrying that cross. And that means that picking up trash in the hallways, right? That means actually finding the lost patient in our corridors within the hall. A lot of these facilities were built in the 1940s, 50s, 60s, and they're hard to find. And so being a leader in a healthcare organization means that you are patient facing, and that you are here for the patients, you're here for the community, and that is quite literally everybody. That is the culture that I like to create, or we are trying to create, and that I think all healthcare organizations should create.
I want to follow up on that. You talk about culture. I've also worked with your COO, with Jason Kreitner, for a
Think
long
very highly
time.
of you, Steve. Yeah,
He's awesome. But I'll
yeah,
tell you one of the things that Jason and I have talked about, and you just talked about culture with Mary. Mary and Mary, I'm going to coin this phrase. I've never used it before. She always goes, we go through all this stuff, and Steve goes wherever he wants to go. But this is where I want to go. Creating what I like to call a culture of honest feedback, meaning a culture. Now, you have your executive team with Jason and Pam and others. How the heck? And we have a culture of very direct, honest feedback. And I'm not sure everyone on the team always appreciates my feedback, because it's pretty direct, and it's how it's delivered. Mary will remind me. I get it, Mary. I understand. But my concern is this, Dustin, that too many organizations, too many top-level leadership teams are not that candid with each other with feedback. I don't want to hurt someone's feelings. How about you're helping them? I know I'm on my soapbox, but how the heck do you create a culture where honest, constructive feedback is the norm, and not, oh my God, I can't believe she said that to me? Please.
yeah, Steve, I love that too. I mean, we've heard the term radical candor and leadership for quite some time now, and I
Yeah.
think it's two components. Number one is ownership, and it really is about owning whatever lane that you are currently in, and then expanding outside of that lane. And then the other aspect of it is really that radical candor. And the radical candor can only happen when you create a culture of psychological safety, right? Where someone knows that I am not attacking you, but if you are going to be better as a person, as a leader, if we are going to be better as an organization, then you need to hear when this is going awry. That is something that I have, and what you will find is that you seek those people out, right?
That's right.
And then the people on the team actually start to turn into people who want that feedback, and they might wind up leaving, right? That's not a terrible thing, because they're growing up and up and up, and you need that feedback if you are going to get better. If you want to stay stagnant, then I think you can just say, I'm not interested in feedback or criticism, but we have to get to that place. Psychological safety, radical candor, and extreme ownership. I think those are three critical pieces.
Dustin, did you say extreme ownership? By the way, you ready? This is part, Mary, we'll put up the graphic for the lessons in leadership. We keep rotating the top 10 leadership books. This one always winds up in extreme ownership. But also you said crucial conversations. You said, radical candor. And one more, real quick. We'll talk about emotional intelligence, Dr. Daniel Goleman, in another segment. Mary, I don't have 100 books here. I only have a couple that really matter. We got a couple of minutes left. I'm sorry for going on my leadership book rant. Go ahead, Mary. By the way,
Last question for me.
She's texting me saying you're monopolizing the time, Steve. Go ahead, Mary.
I'm here. I can add to the conversation. So my question just is about trust and leadership. And Steve and I trust each other. When Steve goes off and talks about his other books, I would love to get your perspective on what trust in healthcare in particular, because you are talking about saving lives. What does trust mean to you when it is tied to leadership in a healthcare setting?
Yeah, trust for me in leadership within healthcare is especially important, because what people want to know, number one, is that you are there with them. These jobs are incredibly hard, whether it is a frontline staff in the emergency department, even within the finance department. These are incredibly challenging times for healthcare, and people want to know that you can be there with them. I might not be able to do exactly what your job is, but I am going to be there with you. And this idea of presence in healthcare is something that we are trying to build up again as well. Of the executive suite is actually with the team, right? There is not this higher level that sits in a ivory tower and then rules down from afar, but rather we are incorporating feedback from you. We know that you know best, and that when you give that to us, we're going to do a couple different things. We're going to digest that feedback. We're going to tell you why we can or can't do it. And then we're going to close the loop. And that creates that trust, I hope, in an organization that, back to culture, perpetuates that culture that we all want to see in a healthcare entity, especially like St. Joseph's.
And finally, Mary, this was not planned. We'll be promoting this book, Speed of Trust, Stephen Covey, the one thing that changes everything, trust. Dr. Dustin Riccio talked about it. Mary and I are going to be doing a seminar, a mini lessons in leadership seminar on trust and leadership, right, Mary?
That is correct.
And I trust that we're out of time. Hey, Dustin, I want to thank you for joining us. The first time will not be the last time. We look forward to working with you and Jason and Pam and the great team at St. Joseph's moving forward. We wish you all the best doing important work.
Steve, really enjoyed it. Thanks for having me on. Thank you, Mary.
This is Lessons in Leadership, and we'll be right back right after this. This edition of Lessons in Leadership is made possible by the Vicino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, Jingoli Construction, the New Jersey Sharing Network, Horizon Blue Cross Blue Shield of New Jersey, the Helix, Fedway Associates Inc., the Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Leadership at the youngest ages. You're never too young to be a leader. And the two leaders we have on are going to talk about it. Dr. Marissa Muoio. She is the Director of Strategic Initiatives and Leadership at Stuart Country Day School of the Sacred Heart. And also talk about a young teenage student leader, Briella McCoy, freshman at Stuart Country Day School of the Sacred Heart. Good to see both of you. Thank you for joining us.
Morning, Steve. Great to be here.
Hey, Doctor, tell us exactly what the Stuart School is and why it has such a culture of promoting leadership.
Thanks, Steve. Stewart's a very special place. We're located in Princeton, as you mentioned. We are a K-12 girls' school, but we also serve young boys. We have a co-ed preschool on campus at the early school as well. We are part of the global network of Sacred Heart schools across the country and the globe. Just last week, I was in New Orleans for our North American Sacred Heart Conference for our Educator Symposium, and we educate young women to lives of exceptional leadership and service.
Love it. And I met you at the EJI Excellence in Medicine Awards with our partner and friend and collaborator, Patricia Costanti. And when Patricia, we've been talking about Stuart for years, and her daughter Stephanie was there as well a few years back. And here's the thing that struck me right away. Your communication and the young women around you, their communication was strong, confident, and clear. Before I get to you, Briella, I'm going to ask you. And then I'll come back to you, Doctor. Why is it, Briella, that so many of the young women at Stuart are such confident communicators? Talk to us.
There are just so many reasons. I mean, only being in Stuart for about a month now, I can see the classes are curated to just encourage students to really speak out and speak their minds. And especially in all of the clubs that I've been joining, I've really been enjoying my time here. You know, it's a really inspiring environment and a comforting environment where people can just feel free to speak their minds and have those opinions and not be afraid to share them.
And Marissa, that's only a month in for Briella.
Yes. It's unbelievable.
Yeah. Hey, talk about the grant that comes from the EJI Excellence in Medicine Award from EJI to Stuart What is it and why is it having a great impact? And then Mary will jump in.
Yes, as part of our of Stewart, we have a National Center for Girls Leadership here, which provides us and affords us the opportunity to have a leadership curriculum for grades K through 12. The EJI grant came through as part of the National Center for Girls Leadership and allowed us to create a fully funded middle school program for girls in Mercer County so that we can really continue our mission here of promoting leadership for young women in the greater Mercer County area. We then partnered with Princeton University and the Watershed Institute, particularly Princeton University's Office of Sustainability, to create this National Center for Girls Leadership Summer STEM program.
That is excellent. And how did Mary jump in? Because
you're going to ask the same question that I was going to ask. So Briella, I had the opportunity to talk with you and Dr. Muoio a few weeks ago. Share your experience. It was a 3-week program this past summer. I know that you've only been at Stuart for a month now, but you had that unique opportunity to participate in that summer leadership program. Tell us about what that meant to you.
I was over the moon when I found out that I'd be able to go to this camp. I mean, I am all for science, learning about the environment, and leadership in general. So I was extremely excited to go here, and each day was a new thing we learned. And I took away so much from this camp about the environment, leadership, and like different women in leadership. And it was amazing.
Hold on, Briella. Where does your passion come from for the environment, sustainability? Where does that come from?
Oh my goodness. I mean, seeing the way that we treat the world now and how it is escalating, like how these problems are escalating so quickly, it really just, ignites like this worry you have. Because if you look at data from not too long ago, like a few decades ago, you'll see how much worse things have gotten. I mean, of course, there are so many good things happening, but especially with global warming and how we are just polluting this world. And I got to learn a lot about that at this camp. And I got to learn different solutions and different ways that we can combat this.
Love it. Mary, stay with it. I know you got a track of questions.
No, that sounds great. And Dr. Muoio, you and I also talked about the leadership skills, the particular leadership skills that you're looking to instill in these young women, particularly the high school age women that are going to help to prepare them for the world. What have you found, or is there a particular leadership skill that is essential that you're making sure that these young women are learning at Stuart?
Yeah, thank you, Mary. There's several, but ultimately, if I had to really summarize what we're looking to create in our leadership or our brand, Stuart's brand of leadership, it's really the next generation of women who aren't afraid to communicate, as you mentioned, Steve, confidently, with courage and with confidence, and then also to really understand what their impact and the impact that they can have on others has in the greater world.
Follow up on that. Marissa, where does your passion come from to do this work?
I'm a passionate educator, Steve. I've been in Catholic education my entire career, in my entire life. And I was really, I say, raised by two different charisms, the Dominican charism and the Sacred Heart charism. And I truly, truly firmly believe in what my role as an instrument within the world to do good. And I think that when we've been doing a lot of research and investigative work around the role of spirituality, any spirituality in the context of young people today and how that contributes to purpose. And when students can really get outside of themselves and understand what it means, whether we want to define it as civic duty or just doing good in the world by virtue of any type of religion or spirituality base that they have, that they feel their sense of purpose. And we're committed to providing an open environment for them to express themselves in that way and to be able to communicate that purpose, feel that purpose, and then share it with the world.
There's not enough of that.
Mm.
And I'm not going to, Mary, I promise I'm off my I'll stay off my soapbox as best I can.
Can I ask Briella one more question?
You don't, oh yeah, since when do you have to ask me?
I just wanted to make sure. I know we're also managing time. And Briella, again, we talked about the summer program that you were involved in, and you learn, you research, and you get to know about a bunch of different women leaders. And I was really surprised when I had asked you then, and I would love for you to talk about now. Who was your favorite woman leader that you learned about this summer?
So I would have to say that learning of Marie Curie, we all know and love her. She was definitely my favorite to learn about because
just tell folks who don't know. Tell folks who Marie Curie was and why she still matters?
So Marie Curie, she researched radioactive materials and she really committed herself to her work. And she unfortunately died at such a young age because of what she researched and what she exposed herself to. And I think that's so inspiring because imagine being so dedicated to learning about something, to share this information with others, that your own life, you have to pass away for it. It was amazing to learn about. We read a book on her and we got to find some little details about her, and it was really interesting.
You know, as we listen to Briella, I'm going to follow up and final question for you, Marissa. We do a separate series called Remember Them, where we feature people who have passed, but have had a great impact on a range of people, not just in New Jersey, the region, but the nation internationally. What's it like for you to hear one of your students, a freshman who's only been at Stewart for a month, talk about Marie Curie and being exposed to her and then being inspired by her? What's that like for you?
It's moving, it's emotional, it's powerful. I think when I consider my career and the longevity of my career in education and the trajectory of it, this is the why. For our students to be a part of a mission that inspires them in that way, where they can learn inspiring stories of women in particular, powerful women who have contributed in some way to the greater good, and for them to recognize that they themselves have that ability and that power to do that and carry it forward. And that's what we're all about. And that's what inspires me to continue to stay in education, and particularly education for young women.
And Steve, one thing before we sign off, I also want to say, Briella, if I'm not mistaken, you did receive a 4-year scholarship to Stewart, and I just wanted to say congratulations for that as well.
Thank you so much.
That's awesome. And also to the folks at EJI, to Patricia Costanti and the folks who secured that grant for Stewart to make a difference in the lives of so many young women like Briella. It's such important work that doesn't get enough attention. Dr. Muoio and Briella, I want to thank you so much, and we wish you all the best. We'll stay on top of this story. Thank you.
Thank you. Thanks, Steve. Thank you, Mary.
You guys, stay with us. We'll be right back.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Mary and Steve, Lessons in Leadership. Hey, Mary, we haven't done, by the way, before we do some leadership quotes, I want to remind folks that we have a leadership library on our website. Sylvester will put up our website. There's a bunch of new material on there. I just did a speech for Manufacturing Day, or Made in New Jersey. It was all about manufacturing. That information will be there. I don't know if we're going to get some video from that as well. But at the same time, our leadership library, which is always our top leadership books, check that out as well. Steve Adubato, stand-deliver.com. SteveAudubato.org is our...
Yep, you can go there too. There's a lot of great content, but if you're looking for our leadership library, you're going to find it at stand-deliver.com.
Okay. You may also find some leadership quotes. Mary, in preparation for the show, you keep giving me these leadership quotes.
And we haven't gone to them in many months, so I'm really excited that you're going to use them.
All right. How about Alexander the Great, who said, "There is nothing impossible to those who will try."
Correct. And I picked that one for a lot of reasons, not only because Yoda from Star Wars said there is no try, there is only do, but Alexander the Great, we definitely have to give him some props for saying there is nothing impossible to they who will try. So many times our first reaction as humans is to push back, and if something is really hard, seems impossible, I would put it in air quotes, but Zoom may put some sort of a image up on screen. But we believe and we trick ourselves because the easier thing is to come up with reasons why we can't do something. Instead, at least try, give it a shot, and then if there's enough valid reasons to why you can't do something, then you can pivot, but at least try.
Well, let me push back a little bit, because there have been things I've wanted to try to do that you have pushed back on, that our top team members on our media production company have pushed back on and said, why are we trying to do that? We don't need to do that. You always say the squeeze and the juice. What do you
juice,
say?
yeah, yeah. Thank you to my brother-in-law. Shout out to you, Uncle Craig. He always talks about the fact, he goes, is the juice worth the squeeze? And pretty much what that
Now we're
means
going
is,
to quote is it your brother-in-law?
yeah, it's my brother-in-law, but he goes by Uncle Craig
Okay,
in the
put this in
family.
it. Is the juice worth the squeeze? What does that have to do
Is the
with?
juice worth the squeeze? I mean, I don't know if anybody's ever actually tried to hand squeeze some orange juice or some grapefruit juice. It takes a lot of effort, right? And you only get about this much juice. Sometimes that juice is really worth that squeeze. So sometimes if somebody brings, and again, we've talked about it here on Lessons in Leadership, we have the privilege, you and I, we have very open communication, and I'll say, Steve, are you sure you really want to go in this direction? And does it have enough impact for the amount of activity it's going to be?
Yeah.
So we have those candid conversations. Not everybody has the ability to do that, so they'll just do. But
Yeah.
oftentimes you and I will share those ideas back and forth to see if the juice is worth the squeeze.
Let me give you a concrete example of this. So, April, you'll appreciate this. April, our makeup artist. We should show a picture of April every time I mention her. So, this is Mary. This is a conversation with Mary. Hey, Mary, I've been thinking, what about if I teach a graduate course at a particular university on leadership or media leadership or crisis communication? I've been thinking, I want a distinguished professorship at a university, and I've talked to different universities, and I like to do an entire semester every Tuesday night from 6 to 8 or whatever it is. And what do you say to me?
Well, that's great, but who's going to do it with you? I always say, Steve, you always think it's a good idea at the time. And then when you're on your way to this, whatever it is, and you're missing one of your kids' field hockey games or something, something's on TV that night, you're like, why did I agree to do this? But in all seriousness, sometimes it does make sense, but more isn't always better. Sometimes it's just more. So you and I have agreed that sometimes
Hold on
you
one
don't
second.
have
That's
to,
another quote from Mary Gamba.
oh, right?
So would you say more?
Yeah, sometimes, yeah, more isn't better. Sometimes it's just more. I have a lot of them. I'm just
Go ahead.
realizing.
Forget about
And
Alexander the Great. Go ahead, Mary
yeah,
Gamba.
the quote from the great Mary Gamba. I think it's from Jerry Maguire, actually. I did not coin this phrase, but sometimes it's just
No,
more.
that's Show Me the Money, but that's another one. Go ahead.
No, I think it might be in that movie though. But yeah,
You had me at hello.
you had me at hello.
Okay,
So
these are just ridiculous quotes. Okay, what's the more is what?
more isn't always better. Sometimes it's just more, meaning we always feel, again, as humans, we want to put more and more and more on our plate. Why? We think it's going to make us be relevant. We think that it'll make us look, established, and did all these great things. You and I have realized over the years that you could teach a course or two, an evening or two, but it doesn't have to be a Monday and Thursday for an entire 10 weeks to be as effective. And I've been there on the receiving end of those calls. Why did I agree to do this? So more is sometimes just more.
So Mary will say to me, so it's 12 weeks. You've got to go every Tuesday at this time or whatever day it is. She goes, what about if you did a guest seminar or lecture on leadership? You did it one time. We'll do a lot of promotion about it.
Yeah.
And who knows the
You get
difference?
the same
whether
title after your name and your bio.
he was a distinguished scholar who came to the university to deliver this seminar. You think people,
Exactly.
and I go, you know what, Mary, I did one instead of 12, and it doesn't always have to be more. Okay, yeah, that's it. By the way, this segment of Lessons in Leadership just wound up being quoting Mary Gamba.
I love it. These are fun. But thank you for watching, and we will catch you next time.
Wow, that's a new quote. Thanks for watching. I'll see you next time. Mary Gamba. See you next time. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, Jingoli Construction, the New Jersey Sharing Network, Horizon Blue Cross Blue Shield of New Jersey, the Helix, Fedway Associates Inc., the Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.